Alrighty, you're live.
Hey guys, it's Dr. Emer. I have one of my new patients here today. She's really sweet, and I'm super excited because she has the type of scarring that I know I can get a big improvement on. And here's the thing, scarring's a process. It's like going to your personal trainer for the first time and deciding on your ultimate goal. So when I came in and talked to her, I said, do you want a big improvement in one treatment? Do you want to take it slowly? What do you want to do? Most of my acne scar patients want the biggest they can get right away. She knows, I can tell from the conversation we had, that she knows it's going to be a building process, going to take time. And that, just like exercise, you're going to have to do treatments all the time. But we can do one larger treatment to begin to give her some improvement. So what I'm going to do today is we're going to get her on skincare to start repairing some of the sensitivity she has in her skin with the redness. We're going to use that skincare to prepare for a very strong laser treatment that we'll do in a few weeks. But right now, this is a kind of our testing to see how well her skin does with doing TCA cross for acne scars, her ice pick scars. Now, she also has really interesting scarring. Smile for everybody. See right here how these scars go into her fold, relax. That always tells me that she had very severe cystic acne that caused inflammation under the skin. And literally when the cyst disappeared, it pulled her skin down and it caused atrophy of the skin, which means that she has basically skin looseness there. So to improve that, we're going to actually have to physically remove them. We're going to have to surgically cut those out, punch excision. And then we're going to laser on top to get improvement over time. So we're sitting here talking about the long-term plan because in one treatment, we're never going to get what I would be happy with as a great result. But in a series of treatments, we will. And my goal would be then also to decrease her redness and just overall, make her skin glow a little more, make her feel confident that her scarring is improved. So we'll be able to get a nice improvement initially with this TCA cross, and then by the time this heals, we'll laser. So we're going to fill it in, and then we'll laser the surface. So we might only need to do a few TCA crosses in the future, really, not that many, because she's going to do a stronger laser, hopefully. Turn all the way to left. So what we do with the TCA is we go really slow. Small bits into a lot of the ice picks. Can you go a little closer with the light? A little bit more. There you go. And we're going to use a 70% concentration at very low amounts. And each little scar, I really only want to scab for 3 to 5 days max in the first treatment. So we're only going to do a mild frosting. I don't want to irritate her too much. We need to see how her skin does. Turn a little towards me just a little bit. Yeah, perfect. And we're using our side light because now shine above directly on. Yeah, there you go. We're using the side light and we're using it in different capacities so I can see.
What should she expect post TCA cross?
So I always tell people you're going to have little scabs there. This frosting goes away pretty quickly and then it turns kind of a grayish color. And then you get these little scabs there for 3 up to 7 days. Anything more than 7 days is going to be a little too much, especially for her skin tone, but it will heal fine unless it's doing turn all the way to the right. We're going to let that sit. We're going to come back. Now, if you see all the ones that I've done.
What does it feel like?
It's just like, it's a little tiny sting, but not bad. It's completely bearable.
And the thing is, you don't really want to numb that much for this. We only do when we do a combination treatment because you don't want to interfere the oil on the skin and the oil in the cream. We want to limit that because we want the acid to be fully functional on the scarring. So I always tell people, I'm sorry, don't tell everyone I tortured you. And these larger ones that you see here and here, we're not going to TCA those because we need to remove those. You could do subcision and filler, which will probably end up doing a small bit, but not that much because I'd rather get her, that big treatment to get the most outcome first. Now shine for me on the lower portion. Yeah, like right there. Good. So now we're on the side angle, and we can see any of the ones that we've missed. It's just super important you guys diligent, and also please don't order this on the internet because you watched me do a treatment. I have now had to repair so many people's skin it's really unfortunate. You know, go to an expert. I know there's not that many people that do this, but it's your face and it's your long-term life, you know. Take the time to focus on going to someone good. This took me many years to figure out and to do. And even with me, it's not 100% perfect. Nobody is, but you do the best we can because we care. So, okay, turn all the way this way. So now we go back. You see how we left it a little bit. Now do me the favor to shine right. Same thing. So you see how on that side light now I can see a lot of these other little scars that I couldn't see before? The angles truly matter. That's why I know my patients always come in telling me I look terrible on the elevator the other day because they're looking in a different lighting. When they didn't actually look terrible, it's just elevators make you look terrible. So there's nothing you can do, you know? So she's doing great, you guys. And
Will she have to stay out of the sun for a couple of days?
yeah, I mean, anything you do energy-based or trauma-based, you really want to protect your skin from the sun. She's young and doesn't have any wrinkles and sun damage, so we want to keep it that way. You know, so you got to enjoy your life. I don't want to tell you not to enjoy your life. You want to go on a vacation to Hawaii, you should. But be smart. You wear a sunscreen, use HelioCare. One of our favorite products right now is the Isden sunscreen. It goes on really good with makeup, and it's been in a lot of clinical trials on its effect on the skin. I don't just use products to use a product. It's actually been shown to decrease rates of skin cancer dramatically, even more so than some sunscreens that are out there. Medical grade sunscreen is very important for those that are super high risk. Now her skin tone can do well with the TCA cross, but with laser we have to be super cautious. So we're gonna just be aggressive with her skincare prep. She'll do a peel and stuff later. I don't think she needs to prep as much as the other patients we have. You're almost there. I know it gets a little warm. All these other things are texture, you guys. I know you're probably wondering, like, why is he not going to all these little pores and stuff? They're not all ice pick scars. These are just pores. And yeah, sometimes they improve, sometimes they don't. We're gonna laser. We'll get improvement with the laser. Laser improves those. All right, turn all the way this way. Everything looks good forehead-wise. She's just dry. Nose actually is very good. Just a couple little spots here I missed. Let's get one of those.
Will she be doing the punch excision today, or if not?
No, we're gonna do it when we do the laser. I think that's the best option for her. We'll do it when we laser. Then a week to 10 days later, we'll take the stitches out. The laser will heal. We'll then do a peel and another laser, and it'll blend everything. I think that'll be the perfect plan. Now, you could do it before you laser, let it heal, and then laser. There's options. But I wanna get her in the groove.
What kind of laser will you be doing?
We are gonna do a new laser. It's not even out yet, but it's resurfacing. So you guys will see it when we do a treatment in a few weeks. I'm keeping it a secret right now because we've been testing it. You're all gonna be blown away. It's a really exciting device, but it is a ablative resurfacing, meaning she's gonna look scabbed, but it's gonna heal really well. So that's the goal. All right, so we did a bunch. This is a good amount. If you take a look, turn to the right a little bit. See how like right at the edge, there's a little bit of an elevation? Perfect, that's the exact amount you want. That's 5 to 7 days of peeling. So all these other bigger ones we'll address later, like I said, and let's let these heal. She's gonna do growth factors and silicone gel, and then we'll be ready. We're ready to go. You're gonna do great.
Thank you so much.
I'll be back in a little bit. Thanks guys for following, bye.